In the competitive field of healthcare administration, preparing for an interview is crucial for success. This video will guide you through the top 25 interview questions commonly asked in this sector, along with effective answers to help you shine. We will explore various aspects of the role, including leadership, problem-solving, and communication skills. By the end, you'll be equipped with insights to confidently tackle your upcoming interviews in healthcare administration. 1. How do you ensure patient privacy and data security in healthcare organizations? Ensuring patient privacy and data security involves implementing robust policies and using cutting-edge technology. Regular staff training on HIPAA regulations is essential, as it empowers employees to understand their roles in safeguarding information. Utilizing encryption for data storage and transmission adds an extra layer of protection. Conducting regular audits and risk assessments helps identify vulnerabilities. Additionally, creating a culture of security awareness encourages staff to report suspicious activities promptly, ensuring that patient information remains confidential and secure. 2. Can you explain how you have managed to reduce healthcare costs in your previous roles? Reducing healthcare costs requires a multifaceted approach. I focused on streamlining operations by identifying inefficiencies, such as reducing unnecessary tests and procedures through evidence-based practices. Implementing patient education programs helped decrease readmission rates, which also lowered costs. Negotiating better rates with suppliers and optimizing staff schedules ensured that resources were used efficiently. By fostering a culture of continuous improvement, I engaged staff to contribute ideas, leading to innovative solutions that achieve significant cost savings while maintaining quality care. 3. What strategies would you implement to address budget constraints while maintaining quality of care? Addressing budget constraints requires a multifaceted approach. First, I would conduct a thorough analysis of current expenditures to identify areas for cost reduction without sacrificing quality. Implementing evidence-based practices can optimize resource allocation and improve patient outcomes. Engaging staff in cost-saving initiatives fosters a culture of accountability and innovation. Additionally, exploring partnerships with community organizations can enhance services without significant financial investment. Regularly reviewing key performance indicators ensures that quality remains a priority while financial responsibilities are met. 4. How do you stay up to date with changes in healthcare regulations, policies, and procedures? Staying current with changes in healthcare regulations and policies requires a proactive approach. Regularly attending industry conferences and webinars allows for direct engagement with experts and updates on new laws. Subscribing to reputable healthcare journals and newsletters provides timely information. Networking with peers in the field can also facilitate the sharing of insights and best practices. Additionally, participating in professional organizations offers access to resources and training that keep knowledge fresh and relevant. Engaging in continuous education helps ensure compliance and enhances organizational effectiveness. 5. Describe a time when you had to implement a new healthcare technology or software system. What steps did you take to ensure a smooth transition? Implementing a new electronic health record (EHR) system involved several crucial steps. First, I conducted a needs assessment by gathering input from staff to identify specific requirements. Next, I developed a detailed project plan that included timelines and milestones. I organized training sessions for all users, ensuring they were comfortable with the new system. Regular feedback meetings were held during the transition period to address concerns and adjust processes as needed. Post-implementation, I established a support system to assist users and monitor the system's effectiveness, ensuring a seamless integration into daily operations. 6. How do you manage competing priorities and ensure deadlines are met in a fast-paced healthcare environment? In a fast-paced healthcare environment, effective prioritization and time management are essential. I begin by assessing tasks based on urgency and impact on patient care. I utilize tools like project management software to track progress and deadlines. Regular communication with team members ensures everyone is aware of their responsibilities and deadlines. I also encourage collaboration, allowing team members to support each other when challenges arise. Flexibility is key. Being open to adjusting priorities as situations evolve helps maintain focus on critical tasks while ensuring that deadlines are consistently met. 7. Can you provide an example of how you've improved operational efficiency in a healthcare setting? In my previous role, I identified inefficiencies in patient flow within the emergency department. By analyzing patient data and staff schedules, I implemented a triage system that prioritized cases based on severity. This reduced wait times significantly and optimized resource allocation. Additionally, I introduced a digital tracking system for patient status, which improved communication among staff and minimized delays in treatment. These changes not only enhanced patient satisfaction but also allowed us to serve more patients without increasing costs. 8. How do you approach conflict resolution among staff members? In addressing conflict among staff, I prioritize open communication and active listening. I encourage each party to express their viewpoints fully, ensuring everyone feels heard. Next, I facilitate a collaborative discussion aimed at identifying the root cause of the conflict. By focusing on common goals and fostering a team-oriented atmosphere, we can brainstorm solutions together. It's essential to follow up post-resolution to ensure the agreed-upon solutions are effective and to prevent future conflicts. Building a culture of respect and understanding is key to minimizing conflicts in the workplace. 9. What methods do you use to measure and improve patient satisfaction? To measure patient satisfaction, I utilize surveys and feedback forms that assess various aspects of care, including communication, wait times, and service quality. Analyzing data from these tools identifies trends and areas for improvement. Regular focus groups with patients can also provide qualitative insights. To enhance satisfaction, I implement staff training programs focused on communication skills and empathy. Creating a culture of patient-centered care encourages staff to prioritize patient needs. Continuous monitoring through follow-up surveys allows adjustments to strategies, ensuring that improvements are effective. 10. How do you ensure compliance with healthcare laws and regulations? Ensuring compliance with healthcare laws and regulations involves a multifaceted approach. First, regular training sessions for staff on current laws and policies are essential to keep everyone informed. Implementing robust auditing processes helps identify potential compliance gaps. Additionally, maintaining open communication with legal advisors and regulatory bodies provides guidance on navigating complex regulations. Establishing a culture of accountability encourages staff to prioritize compliance in their daily tasks, while utilizing technology for tracking compliance-related activities can streamline reporting and monitoring efforts effectively. 11. Describe your experience with budget management in a healthcare setting. In my previous role as a healthcare administrator, I developed and managed departmental budgets, ensuring alignment with organizational goals. I conducted regular financial reviews, identifying areas for cost reduction without compromising patient care. Collaborating with department heads, I implemented tracking systems to monitor expenses and revenues closely. This proactive approach allowed us to adjust allocations based on actual performance and forecast needs. By fostering a culture of accountability and transparency, I encouraged staff participation in budget management, leading to enhanced financial awareness across the organization. 12. How do you motivate and engage healthcare staff to maintain high performance standards? Motivating and engaging healthcare staff begins with fostering an inclusive and supportive work environment. I prioritize open communication, encouraging team members to share their ideas and concerns. Recognizing individual and team achievements through awards or public acknowledgement boosts morale. Providing opportunities for professional development, such as training and workshops, helps staff feel valued and invested in their roles. Regular feedback sessions ensure that staff understand expectations and feel empowered to contribute to patient care quality. Engaging staff in decision-making processes fosters ownership and commitment to high-performance standards. 13. What strategies do you employ to reduce hospital-acquired infections and improve patient safety? One effective strategy for reducing hospital-acquired infections, HAIs, is implementing strict hand hygiene protocols among staff and visitors. Regular training and reminders help reinforce the importance of hand washing. Another approach involves utilizing evidence-based guidelines for infection prevention, such as proper catheter care and surgical site management. Additionally, employing technology, like electronic monitoring systems, can track infection rates and alert staff to potential issues in real time. Creating a culture of safety encourages open communication about concerns and promotes teamwork in addressing infection control measures. 14. How do you handle situations where there are shortages in medical supplies or equipment? Addressing shortages in medical supplies or equipment requires a proactive and strategic approach. I first assess the extent of the shortage and identify critical items. Collaborating with suppliers is vital. Establishing strong relationships can facilitate quicker replenishment. Additionally, I explore alternative suppliers and consider bulk purchasing agreements to ensure a steady supply. Implementing inventory management systems helps monitor stock levels closely, allowing for timely reordering. Educating staff about resource conservation and prioritizing essential services are crucial to maintaining quality care during shortages. 15. Describe your approach to implementing new policies or procedures in a healthcare facility. Implementing new policies or procedures in a healthcare facility requires a structured approach. First, I conduct a thorough assessment of the current processes and identify areas for improvement. Then, I engage stakeholders by communicating the rationale behind the changes, ensuring buy-in from staff. Training sessions are organized to educate all relevant personnel on the new protocols. Feedback mechanisms are established to address concerns and gather insights during the transition. Lastly, I monitor the implementation closely, making adjustments as necessary to optimize effectiveness and ensure compliance with established standards. 16. How do you balance the needs of patients, staff, and the organization when making decisions? Balancing the needs of patients, staff, and the organization requires a comprehensive approach. First, I prioritize open communication to understand the perspectives of all stakeholders. Regular feedback sessions with staff can highlight operational challenges while patient surveys can reveal care satisfaction levels. I utilize data-driven decision-making to align these insights with organizational goals, ensuring resource allocation supports both patient care and staff well-being. Collaboration among departments fosters a culture where everyone feels valued, ultimately leading to informed, equitable decisions that enhance service delivery and organizational efficiency. 17. What experience do you have in managing relationships with external stakeholders like insurance companies and regulatory bodies? In my previous roles, I have actively engaged with insurance companies and regulatory bodies to enhance collaboration and compliance. I facilitated regular meetings to discuss policy changes and reimbursement strategies, ensuring all parties were aligned on expectations. By building strong relationships, I was able to advocate for our organization's interests while also addressing stakeholder concerns. Additionally, I implemented feedback mechanisms to gather insights from these groups, which helped refine our processes and fostered a more productive partnership. This approach not only improved communication but also strengthened trust. 18. How do you ensure effective communication between different departments in a healthcare facility? Effective communication between departments is vital for patient care and operational efficiency. I promote an open-door policy and encourage regular interdepartmental meetings to discuss challenges and share updates. Utilizing collaborative tools, such as shared digital platforms, helps ensure information is accessible. Training staff on communication protocols fosters a culture of transparency. I also implement feedback mechanisms, allowing departments to voice concerns and suggest improvements. This approach enhances teamwork and ensures that patient care processes are streamlined and coordinated across all levels. 19. Describe a situation where you had to make a difficult ethical decision. How did you approach it? In a previous role, I faced a situation where a patient's request for a specific treatment conflicted with established medical guidelines. To address this, I initiated a thorough discussion with the interdisciplinary team, assessing the clinical evidence and considering the patient's perspective. I then arranged a meeting with the patient to explain the rationale behind our guidelines while also listening to their concerns. Ultimately, we reached a compromise that respected both the patient's wishes and the ethical standards of care. This process emphasized collaboration, transparency, and patient-centered decision-making. 20. What strategies do you use to improve staff retention and reduce burnout in healthcare settings? To enhance staff retention and minimize burnout, I prioritize creating a supportive work environment that values open communication and feedback. Implementing flexible scheduling options allows staff to maintain a healthy work-life balance. Regular training and professional development opportunities are essential for keeping staff engaged and motivated. Additionally, recognizing and celebrating achievements fosters a sense of belonging. Providing mental health resources and promoting wellness initiatives can significantly alleviate stress and contribute to a more resilient workforce. 21. How do you approach strategic planning and goal setting for a healthcare organization? Strategic planning in healthcare begins with a comprehensive assessment of current performance metrics and patient needs. I prioritize stakeholder engagement, involving staff, patients, and community representatives to gather diverse perspectives. Establishing clear, measurable goals aligned with the organization's vision is essential. Regular progress reviews and adjustments ensure we stay on course. I also emphasize data-driven decision-making, utilizing analytics to guide initiatives and resource allocation. This collaborative, adaptive approach fosters a culture of accountability and continuous improvement, ultimately enhancing patient care and operational efficiency. 22. Describe your experience with quality improvement initiatives in healthcare. Quality improvement initiatives have been a significant part of my career in healthcare. I led a project aimed at reducing patient readmission rates by implementing a comprehensive discharge planning process. This involved training staff on effective communication with patients and ensuring they understood their post-discharge care plans. By collaborating with multidisciplinary teams, we identified gaps in patient education and streamlined follow-up procedures. As a result, we achieved a 20% reduction in readmissions within 6 months, demonstrating the impact of focused quality improvement efforts on patient outcomes and organizational efficiency. 23. How do you stay informed about emerging trends and innovations in healthcare administration? Staying informed about emerging trends and innovations in healthcare administration involves a multifaceted approach. Regularly attending industry conferences and workshops allows me to engage with thought leaders and learn about new practices. I subscribe to key healthcare journals and newsletters that provide insights into the latest research and policy changes. Networking with peers also offers valuable perspectives. Additionally, leveraging online platforms and professional groups helps me stay current with technological advancements and best practices, ensuring my organization adapts effectively. 24. What role do you think technology plays in modern healthcare administration, and how do you leverage it? Technology plays a critical role in modern healthcare administration by streamlining processes, enhancing communication, and improving patient care. Electronic health records, EHRs, enable easy access to patient information, facilitating better decision-making. Telemedicine expands access to care, especially in underserved areas. I leverage technology by implementing data analytics for performance monitoring, using patient management systems to optimize workflows, and ensuring staff are trained on new tools. These strategies help improve efficiency, reduce errors, and enhance patient outcomes, ultimately leading to a more responsive healthcare environment. 25. How do you ensure diversity, equity, and inclusion in your healthcare organization? Ensuring diversity, equity, and inclusion in a healthcare organization begins with creating a culture that values unique perspectives and backgrounds. This can be achieved by implementing comprehensive training programs focused on cultural competence and unconscious bias for all staff. Recruitment strategies should prioritize diverse candidates, fostering an inclusive workforce that reflects the communities served. Furthermore, regular assessments and feedback mechanisms help identify gaps, allowing for targeted initiatives that address disparities in care. Engaging with community stakeholders can also strengthen efforts in promoting equitable healthcare access. In this video, we've explored the top 25 healthcare administrator interview questions and provided insightful answers to help you prepare effectively. Whether you're entering the field or looking to advance your career, understanding these key questions can significantly enhance your confidence and performance in interviews. Remember, being well prepared not only showcases your knowledge but also your commitment to the healthcare industry. If you found this content helpful, please give it a thumbs up and subscribe for more valuable insights. Your support helps us create more informative videos just for you.